Hello everyone, I am Dr. Chinnababu Sunkavalli. Today I will be talking about follow-up care after cancer treatment. So once you are treated with cancer, how do we do the follow-up for these patients? So medical care for people with cancer usually does not end with just the initial treatment alone. They usually come for follow-up to see the specialist even after the treatment is completed. So it is a well-developed follow-up schedule is always given to the patient. Most of the times it's very intensive in the first 2 years, and the next 3 years it will be less intensive. So the follow-up is usually done for about 5 years. So this helps for the cancer survivors especially to have a confidence, and it also helps them to transition into normalcy and to resume their normal activities even as they come for follow-up. So one goal of follow-up care is basically to look for recurrence. If the disease has come back, cancer cells have begun to grow, so that they can usually proliferate and present the symptoms. So to look for the recurrence, usually the follow-up is advised. So the chance that the cancer recurs depends upon the type of cancer and the stage of cancer in which it was diagnosed. So the initial diagnosis itself will help us to understand the propensity of recurrence or the disease to come back. So the type of cancer affects the likelihood of the timing of the recurrence as well, and the symptoms also. So the follow-up visit usually consists of a physical examination most often, and then we do some blood tests especially to look for some tumor markers, and then we also do some imaging tests. Not always follow-up includes a PET scan. So testing recommendations also depends upon what type of tumor it was and what stage it was, and how the patient is performing today. So the patients are also usually briefed about the specific symptoms that they need to watch out when they come for follow-up. So the management of side effects also is important during the follow-up. So the side effects of treatment sometimes are edema, or sometimes long-term effects or the short-term effects. They are also taken into consideration. Sometimes there could be emotional changes or the physical changes in the person's life. So some examples, for example, you look at the thyroid examination for those who took a head and neck cancer radiotherapy. Every year they need to undergo thyroid examination. The thyroid profile has to be done. Similarly, lung function test has to be done for people who have taken bleomycin chemotherapy. Similarly, ECG or the echocardiogram is to be done for people who have taken the thoracic radiotherapy, or people who have taken chemotherapy with the help of anthracyclines as the drugs. They undergo 2D echo or ECG. So it is important also to look for second cancers also during the follow-up, especially head and neck cancers. There is a 5% year-on-year chance of a second cancer. So the intention is clear, that look for the recurrence and also look for second cancer, and give the confidence to the patient during these follow-up visits. Thank you so much for watching this video.